Hello, welcome to the HeartFit Clinic. My name is Diamond Fernandez, your founder and director of the HeartFit Clinic, and today I want to talk to you about what do you do when you have blockages. I get a common question. People always talk to me, well, what should I do? I should just open them up. Your arteries, this is a big thing. Your arteries are not a pipe. They're not something where we can go in there and just take a rotor and scrape it all out. Your arteries are skin, and so if I take, make your fingers a little circle with your fingers, that's what the inside of your artery feels like. It's skin, and so you want to treat it delicately. So it's important on how you do that. So when we look at an angiogram, so let's say we look at this is your right coronary artery, maybe that's your left coronary artery, and it branches off into two. So you got your left anterior descending, and there's little branches of that come off the heart. And if I actually show you what your heart looks like, there's like so many different capillaries inside the heart muscle itself. But when you have a blockage, and let's say you have a blockage that's happening, whatever artery, let's say it's right through here, and you got a blockage right through there. If you did not have a heart attack, and we're trying to say, okay, well, let's open that up. Let's say you ended up with an angiogram and you're getting some pain once in a while, and we found that blockage. What's probably happening and why you didn't have a heart attack is you're starting to develop a lot of collaterals that you can barely even see on this picture or on the angiogram that are starting to feed different parts of your heart, and that's why you're able to keep walking or do an activity that you love to do. Maybe you're now starting to get some pains or something like that. So that blockage is very important to be able to look at. So when we look at that blockage, let's look at it from the inside part of it. So when we look at an artery blockage right through here, so let's look inside the artery. I'm going to zoom in on this artery a little bit. And let's say this artery is blocked quite significantly. Let's say it's blocked, maybe, let's call it 90%. So let's say all that is, it's quite significantly blocked. So many times we think, okay, well, let's just open that artery up. Let's just start to restore blood flow to the rest of the heart. But the fact is that if it's not a heart attack, it might be better to sometimes leave that artery alone and try medical therapy. But people just think, well, we should just open that artery up, otherwise I'm going to get a heart attack. More than likely, you're not going to get a heart attack. Let's say it goes at 90% and you've been surviving there for a while and you're getting a little bit of pains, but more than likely you're not going to end up with a heart attack. Otherwise, you already would have had something. So what's happening, and let me explain what goes on in that stage. Let's say this is the artery coming down, and you got this blockage right here that's really significant, that's 90%. You already got some capillaries that are starting to form around there. And so what our focus is on treating stable coronary artery disease. This is for some people that have blockages that are maybe 50, 60, whatever, but it's stable coronary artery disease. It's yes, medical therapy is a good treatment option, but ECP therapy, external counterpulsation most likely will be the best treatment option for you, along with lifestyle changes, which is what we focus on in the clinic here. So many people think, well, let's just go in and open that up. But let me explain why you should open this up. So let's just make this a little bit less of a blockage. Let's make this blockage maybe a little bit more. And what happens is, and I've talked about this in previous videos, is that you have a layer of skin that grows over that plaque. And now that's quite a significant blockage. You got maybe, I don't know, we'll call this a 70% blockage. What happens in this state is that really what you want to focus on is strengthen this skin right through here to make sure that that plaque doesn't get anything more. Or two, start to form some collaterals around that blockage, just like over here, and start to grow new arteries, which is the process of what we call angiogenesis. And so how you do that, again, is focusing on ECP therapy and lifestyle changes, making sure you're taking the right supplements, all that part of it is a much better treatment option than going in with a stent and that's skin right here. So if you look at it, that's skin here. And if I go in here with a metal stent and disrupt that artery and start to push the blockage out to the side, you still have heart disease. But opening that artery up when you're stable is not the best treatment option. Now, if you're having a heart attack or you're having what we call an acute coronary syndrome, really unstable angina, which is chest pains or when it's very unstable, by all means, that might be the best treatment option for you. But if you have stable coronary artery disease, going in and just stenting it is not necessarily the best treatment option for you. And ECP therapy or lifestyle therapy might be the better treatment option for you. Again, if you have any questions, comments, or observations, happy to answer them for you. This is Diamond Fernandez with the Hartford Clinic, hoping you live happier, healthier, and longer.